Hello everyone, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday and a very special and charming guest, Dr. Erin Lloyd. Alright, so we are doing a forced progression of a video we'd already done, which was cervical retraction and extension in supine. That means laying on your back. This time, if you're not quite getting to end range, and you might know that if you're not getting a full resolution of symptoms. So if that one was helping and you've done it for several days, but you're still not getting quite that full resolution, this is a way to get those joints a little bit closer to end range or to end range, and this might help you fully resolve your symptoms. Okay, so some of the symptoms, pain-wise or tingling-wise, you might have neck pain, upper trapezius pain, shoulder pain, or shoulder blade pain rather, shoulder pain or pain that comes all the way down to the arm. Okay, so any of those are kind of fair game. In a previous video, we'd done a seated version, and I recommend doing that first. So if you had been doing retraction, extension, and a little rotation, and it was helping but not fully abolishing your symptoms, then give this one a whirl. Okay, so again, this is going to be lying on your back. Okay, so Dr. Erin Lloyd is going to show us this because her form is so good. Okay, so again, you're lying on a firm surface. Beds can work if they're firm enough. Water bed, probably not going to happen. Although I don't know if anyone's owned water bed since 1985. You want to be far enough up where your arm clears, right? So your upper back, or you're almost to your mid-back actually. And then you're going to support your head with one hand, making sure, because this is an extension-based exercise, Erin's kind of starting here in a neutral-ish position. When you're doing this, don't start here, and at the end of the exercise, don't come back here. Okay, so try to maintain this position here. All right, so before we do the forced progression, so Erin will just demonstrate 1 or 2 reps of the other one. So she does a full retraction, let's go, and she goes into extension. We're trying to get to end range, so try to move that head back as far as you can. Hold about 2 seconds, and then help it back up as soon as you can with the hand. Okay, so that's retraction and extension, all the way back, farther, farther, farther. Hold 2 seconds, and then back. So if you'd been doing 10 to 15 reps of those for a couple of days and you're not getting your full resolution of symptoms, then we're going to do a forced progression here. So we're going to add a little bit of rotation. So after Erin has done the retraction and extension, she's just going to turn her head no. And they're real small movements. Don't do real big ones. Okay? They're just going to be real tiny movements. And make sure that they're tiny, small movements, and that you're going equally both sides. You'll see a lot of people, they'll turn maybe to one side and then barely get into the other side. So make sure that the movements are equal and small. Okay? All right, so here we go. Erin's going to go retraction, and then she's going to let go into extension, and then little bitty rotations. Yep. So they say in the direction to do about 5 or 6 times. Erin did 4. I think 4 is fine too. So we go retraction. She goes down into extension, and then just little bitty nose. Real bitty nose, and then back. She helps herself back up. Oh, she did 5 or 6 that time. Ooh, textbook.
I'm a real follower.
Retraction, and then extension all the way down. Rotate. Yep. And even as you're rotating, you're trying to go farther into extension. Okay, so that's important that you get your neck, the joints in your neck as far as they can into this direction to know if this technique is going to work for you, and to get full resolution of symptoms if you're needing to go this far. So Erin has decent range of motion. If I were to do it, my head wouldn't go back as far. If we were working, say, with a 16-year-old gymnast or something, female gymnast, her head might go back even farther. So I've heard stories of people doing this with their patients, and the backs of the head is almost touching the table. So it's end range. It's a little bit, it's independent on what your end range is. So Erin's getting to her end range. My end range would come a lot quicker. I wouldn't go back as far. Others might have to go back even farther to get to their end range. Okay, so end range is where the magic happens, and you often have to get to where your end range is to get that full resolution of symptoms. Okay, Erin's like, shut up. My arm's getting tired. All right, Dr. Sam Schroetke here, Dr. Erin Lloyd with Physical Therapy and Hand Clinic of Hillsborough, Technique Tuesday. Physical Therapy and Hand Clinic of Hillsborough. I've said that twice now. It's a free plug. I get a bag of Doritos every time I say it. As with anything, check with your physical therapist or physician before performing any of these exercises to make sure they are appropriate for you. Like us on Facebook. Like the video, subscribe to our channel, make requests, and we will answer your questions or maybe make a video addressing your request. All right, thank you.